Commissioner Marecki. Commissioner Baidoon. Commissioner Anderson. Vice Chair Colleen.
Yep.
Chair Baker McCormick.
Here.
We have a quorum present.
Yeah. Next item.
Next item, item B, Chairwoman's remarks.
There are none. Next item, please.
Item C, approval of the November 28th, 2023 meeting minutes.
So moved.
It's been moved and supported. All those in favor?
Aye.
Any opposed? Any abstentions? Motion passed. Next item.
Item D, unfinished business. There is none listed.
Next item, please.
Item E1 under new business, communication. Excuse me.
Bless you.
Communication from Charlie E. Rose, Director of the Department of Health and Human and Veteran Services, Medical Examiner's Office Division, forwarding the Medical Examiner's annual report by manner of death for fiscal year 2022-2023.
All right. We have Ms. Rose. Okay. Good afternoon.
Good afternoon. I'm Charlie Rose, Director of the Medical Examiner's Office.
Your microphone.
Can you hear me now?
Yes.
Now we
Okay, I'm sorry.
No, no,
Push
it's
it
all
up
right.
to you a little
Okay.
bit. Yeah, that'll be.
Okay, perfect. I'm sorry. So what I have is the analysis of cases of by manner of death for fiscal year 2022 and 2023. We accepted a total of 3,050 cases in our jurisdiction. 2,042 of those cases were autopsy, 1,008 of them were inspections. Of those numbers, we have 2,042 of those that were autopsy. Of course, we have 764 that were accident, 318 that were homicides, 28 indeterminate, 422 that were natural, 85 suicides, and 4 of those cases pending. Of those cases, 2,211 of them were male, 837 of those were female, and 2 of those, the gender was indeterminate. So for this fiscal year, we've noticed that we had a 21% decrease in our homicide cases. And of those homicide fatalities, 87% were males and 13% were females. And the age range for the highest, but the fatality range was between ages 20 and 29. For the accidental deaths, the drug toxicity was the common mode for the accidental deaths. And for our suicide, it was a decrease from 12.5 per 100,000 citizens to 11.5 for this fiscal year, which is lower than the national average for 14.4 suicidal deaths. And of those suicidal deaths, it was 83% were male, 17% female. And that's it. Any questions?
Thank you for that report. I don't know if you received the question, deaths in custody. I think we talked about that before. Do we have a report on that or a report from the sheriff's office?
I can get that for you.
Work with him on that?
I will. Yep, and I'll get it for you.
Yes, I think we need to know, what that looks like.
Okay.
And that would be from not just the sheriff of Detroit, but the
All
other
the counties.
Yes.
Yeah. Okay, no problem.
Okay, all of the communities. In addition, the homicide. Yes. Oh, go ahead.
I was just going to ask about what you were referring to.
Mhm.
Was it the issue of the warrant enforcement? Was that? No.
As far as the death in custody,
Oh,
or we're
we're still in number one.
One,
Okay,
uh-huh.
I'll hold off.
Oh, okay. In addition, the homicides, and I don't have the report in front of me, but as far as Black males, Do you have the number?
I don't have it on me, but I can get it to you.
Okay, because I would, is it a way you can break down the number so we can see the race
The race.
of when it comes to homicide and if it was drug induced?
Okay.
I'd like to see the numbers because there may be some other epidemic related issues in certain communities that we're not seeing if we're not looking at it by race.
Gotcha. Okay.
So,
Mhm.
so opioid addiction
Mhm.
and deaths,
Okay. And homicides, right?
right? And breaking it down by race would be nice.
Okay. No problem.
And then deaths in custody, and if that could be
Broken down by race as well.
by race as
Okay.
well. Thank you,
Mhm.
Commissioner Helene.
Thank you, Madam Chair. And thank you for the report.
You're welcome.
It's good to get a lot more information out of the MEO's office than we're used to. My question is kind of related to what the chair was asking. One of the things when we went into this contract with Wayne State University, one of the things that was talked about then is Wayne State can use this data in terms of public health, identify trends that are out there. The chair alluded to some of those. Is there going to be a more formal report? Like, what did we learn this year
Yes.
with
That's our
data?
plan. Yes.
And because I know we're only, what, a year into this,
Yep.
year and a
Yeah,
half.
1 year.
And so it does take time for that data to emerge.
Yes.
So we will be getting a report
Yes, you
on
will.
public health. Is there some idea when?
I don't have a date at this time.
It's not tomorrow,
No.
and hopefully it's not 2 years from now.
No, it won't be. I'll be
Yeah.
sure of that. Yes.
Okay, well, I'll look for that report because I think that is important.
Mhm.
And I like that about working with Wayne State
Mhm.
is that we would get more public health, identify trends, things that are going on out there.
Yep,
So,
absolutely.
all right, well, I'll look forward to that report, maybe including what the chair was discussing.
Mhm.
Thank you, Madam Chair.
Thank you, Commissioner Helene. Commissioner Marecki.
Thank you, Madam Chair.
Mhm.
I was just looking at your very clear charts.
Mhm.
Thank you for that. What is unsafe sleep under accidents?
I actually don't know. Yep. I can find out. I can ask the doctor
Yeah,
and
I'm
I can
just
find out for you.
curious.
Yep.
Definition.
Yeah, thank you.
Any other questions? All right, thank you very much.
Thank you all.
Next item, and we can take all of the items together.
Item 2, communication from Melissa Fernandez, Director of Juvenile and Youth Services Department, forwarding the report on the Warrant Enforcement Bureau, including status, activities, accomplishments of the WEB.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile and Youth Services.
Good afternoon.
Good afternoon. This is our utilization report from the Warrant Enforcement Bureau. They provide all of the tethers for our youth who are court ordered to tether. Warrant Enforcement Bureau is a collaboration between the Third Circuit Court, the care management organizations, and the JAC. To point out, this last fiscal year, we've seen a significant increase in youth being placed on tether. There are a lot of reasons for that. We've got the juvenile justice reform efforts happening in the state. And so we really are taking a closer look, the jurists are taking a closer look at who's ordered to detention, whether or not they can be treated in the community. And so we're seeing an increase in youth being placed on tether.
Commissioner Anderson.
I'm good.
Oh, you good now? Okay. All right, any other commissioners? Commissioner Marecki?
Thank you. This is a little off topic, but why don't you just give us a brief overview of the Christmas party you had at JDF?
Oh, the Thanksgiving party, correct?
Oh,
So
Thanksgiving party. Okay.
We had 5 days of Thanksgiving dinner for all of our families and our youth. And so we had the opportunity for every single child to have 2 family members come and have a Thanksgiving dinner with their young person. We had the units decorated for Thanksgiving. We had a lot of guests and visitors, and we had pictures. And again, we had 5 days, 110 kids, 2 visitors for each kid, and they had a phenomenal time. We had the entire thing catered. It was the first time that many families were able to hug their young person in a couple of years.
Nice.
Very nice. Are you doing anything for Christmas?
We are. So we have the Adopt-a-Pod program. So each pod is being adopted, and they'll have meals and they'll have gifts. And we have a lot of community partners that are being able to provide this. We have a lot of community providers providing daily activities during the Christmas holiday. We also have special visits for our families.
Great. I just thought everybody would like to
Thank
hear
you.
some positive news.
Thank you.
Thank you.
That is great. That's great. I also just read that the state is opening more treatment beds. Can you talk a little bit about that?
So the state has moved to open rite of passage. That's the only one that we are aware of. They are opening 20 beds specifically for Wayne County youth. As of this week, we've had 6 kids placed from detention there, and they're placing 2 kids a week until we get up to 20 kids. The hope is that they can expand to 60, but right now they are only starting with 20 kids that need secure placement. Today, our census at JDF is 106, and about half of those kids are waiting for secure placement.
Okay, and so it's good that we're moving in the right direction, I think. So that's positive news. I guess the only issue I have and other commissioners is that we don't hear about it from you or the department. And I was just wondering, is there a way in which you would like to communicate the good and the bad, not so good
Absolutely.
news to us?
Absolutely. I just completed a significant report on JDF and the updates, and I've shared that with the executive team, and I'd love to share it with the commission. So I will definitely forward that report for your review.
Okay. And in the future, though, as far as things are occurring, because what happens is I will get a call and I'm like, I don't know anything about it, right? And then I read it in the paper, and I don't think that's a good look. So I was just wondering, is there a process in the future that, as the current chair, anyway, I don't know what's going to happen in the future, but if there's a way that we can communicate any issues that come about that we should be aware of.
Absolutely. We
Or
will-
just an email, just to notify the committee that something happened, and then that way.
Absolutely. And I'll work with Darcel, and we'll make sure that we have a process moving forward.
Okay, thank you.
No
I
worries.
appreciate that. All right, any other, Commissioner Vice Chair Colleen. All right.
I see, I might stop hitting my button.
Oh,
Thank you, Madam Chair. Good afternoon, Director Fernandez. On the last page of your report, you have a chart for the last 3 years. So we have 4 times as many people on Tether that we had three years ago. We have 3 times as many as we had 2 years ago, and then doubled again from last year. Has the number of people, because you mention it, and right above the chart, the last thing in the report, we could use more people. So for what we see on the chart here, with all of these increases, are we dealing with the same number of people to monitor this?
Yeah. So if I could just explain, the CMOs monitor the youth on Tether.
Okay,
Right? So what we're talking about is the Wayne County Sheriff. The Wayne County Sheriff, they install the tether, and they also have to engage in the apprehension when we have someone that has to be apprehended. For this new fiscal year, I did increase the number of Wayne County Sheriffs for the tether unit significantly. The
Good.
barrier there is getting those bodies from the Wayne County Sheriff. So although we did include it in the budget was approved, we haven't been able to increase those bodies because of the barriers to hiring with the Wayne County Sheriffs.
and what kind of issues does that present to you, not having enough?
We just don't have the manpower to be able to conduct the spot checks and to conduct the apprehensions that we need in order to ensure that the community,
Yeah.
is safe from youth on tether.
Is there somewhere in the law spot checks should happen.
I don't know if it's in the law. I do know that it's best practice. We should be engaging in spot checks and not just as an I got you, right? But just, community policing and ensure that youth are where they say they are and offering support too as needed.
How many more people do you think you need?
I can tell you that for the fiscal year that started in October, I budgeted for 17 total people.
And you have how many now?
One.
Because as a matter of policy here and public policy, I think the idea, as we've talked so much here, that not incarcerating with juveniles is a good idea for many reasons. But then if we have kids out on tether and can't properly do the spot checks and that kind of stuff, and then that's when the public gets all upset. Hey, they were on tether and they committed 12 more crimes or something. What's going on? So I agree with the program, but we must adequately staff it so that it is something that protects public safety and it protects the youth. All right, well, we got to find a way to encourage the sheriff to share more people with you.
Yeah, and I think as you've seen, we've decreased the stress in our detention center, but we've just moved that stressor to another.
Okay, so we got to get, it's in the budget.
Correct.
So now we got to make sure that the budget that the commission approved is a budget that's followed. All right. Thank you. Thank you very much. Thank you, Madam Chair.
Thank you, Commissioner Marecki.
Thank you. So the sheriffs also monitor the adults, or we have another company doing that? It's the sheriffs?
So it is a company. I believe, I can't speak to the sheriffs, but I believe they have a contracted company that does it.
Yeah, I remember a contracted company. I just didn't know if they did the enforcement. I can't remember. So these 17 that you need, are these like what kind of hours? Like full-time 17?
Correct. It would be round the clock for, the spot checks and
Okay.
apprehensions.
Yeah, I mean, this is a problem that's throughout the whole country. Police departments, sheriff departments, there's just not enough.
Right.
Not enough people that want to do it anymore. So thank you.
Commissioner Khalil, Vice Chair.
I thought of it, but I didn't ask, but I'm going to ask now. This is a job that can only be done by duly sworn public safety officers.
I'm not sure. I would think so in order to provide the apprehension piece.
Yeah, but the spot checks, that has to be done by
It does not.
sworn peace officers.
It does not.
Because when we were discussing the adults, perhaps that's a way. That, yeah, there are certain functions that have to be done by duly sworn peace officers, but for the functions that aren't, and you're paying for it in your budget anyway, looking for 17 more people, 16, then maybe there's a way to use that money. Otherwise, it's important that we do. I know you think so, but it's important that we do the proper supervision of the folks out on tether. And if we can't get it from the sheriff, but we can get it somewhere else, I'm all in favor of that.
Thank you.
Thank you. Thank you, Madam Chair.
Commissioner Anderson.
Thank you. Thank you. I just wanted to ask, are there guidelines? I'm sure there are guidelines about who are of the youths which are eligible to be put on tether instead of kept at the facility.
Yes, and that decision is made by the jurist and the prosecutor at the court. We don't make that decision as far as tether. That comes strictly from the court.
Okay. I too am quite concerned of that if we don't have the proper supervision of those that are out on tethers and the enforcement, then we may need to scale back on what we're doing with tethers because it's just not a good idea for the public. And I think that should be our primary concern is making sure that people are safe. And do we have any numbers on those that are on tethers that are committing crimes still?
We do, and I believe Commissioner, you did request that data, maybe the last meeting, and we did submit a response.
Mhm.
I don't want to misspeak and say the wrong thing, but we did submit the number.
Okay, I don't know if you were
I-
furnished that.
I
or-
don't know if I
haven't-
remember
I don't
asking the
see.
question, but I can't recall receiving the report.
Yes, it
So-
was submitted, and I can follow up
If
and
you can
resend it.
resend
For
it,
sure.
please, yeah.
Yeah, if you could,
Yeah.
if you could make sure all of
Yeah,
us got it,
yeah.
because I think that's
No
extremely
problem.
important. That's our primary responsibility, I think, and then
Other
secondary is,
incidents report.
okay, thank you.
You have that?
Thank you, Madam Chair.
Correct.
Now they're gonna prove that they.
No, Commissioner Darcel Brown, Legislative Liaison for the Wayne County Executive. Excuse me, I will refer that report over to you again, so it'll be at the top of your email and to the committee as well.
Great, thank
I
you.
can,
Mhm.
Madam Chair?
Yeah.
Mr. Brown, did you send that to us?
Yes, it has been sent. Well,
Okay,
I believe
but
it-
what I want to know is who did it go to?
and let me check into that. I know Commissioner Anderson has it, but I want to go back and
Well,
review my emails
See,
just to make
there's a
sure.
practice when questions get answered in committee, and this is all committees. All right, Anderson asked about it, so we'll send him an email.
Mhm.
And now you got 14 other commissioners totally in the dark. I would hope that in the future, that when questions from commissioners come at committee meetings, that answers go to all 15 commissioners. This was asked about to make sure that other people on the committee receive it, but that all commissioners should receive that kind of information. It can't just go to one or two people, because then it depends on it being forwarded or, something like that. So I'm hoping on these requests in the future, the administration would send answers to all 15 commissioners. Thank you. Thank you, Madam Chair.
Or at least
Well, we
this,
sent to the
this
chair-
committee.
Right,
Yeah,
to the
at least-
chairperson and then the committee members as well.
Yeah.
That's what we try to do, try to
Yeah,
make sure
but
we follow.
that's still, I mean, what's it costing you? We got a third of the commission right here. It's not like it's a budget buster to add the other 10 commissioners. You've got a one button that you can send that to everybody. So,
Right. And I'll
So-
check with the clerk, the policy director, Pamela Lane, because we do forward it to her so that she can.
well, she would
For
be
that
part
as
of it.
well.
Yeah, but see, that's
Right.
what happens with these things too, right? Because then it depends on it being forwarded to everybody.
Mhm.
Or who should it be forwarded to, all of that kind of stuff. Yeah, include her. She needs to get that when it's asked about, but the response coming back should go to all commissioners, not just a select list. I don't know how difficult that is.
Understood.
Yeah. Right.
Well, kind of, but yeah. So thank you, Madam Chair. That's my thing.
Thank you, Commissioner
Yeah.
Khalil. Also, what was the timeline that report was put together? What is that, this year, last year?
The report.
The report that we're referring to, the tether and its incidents of those that are currently on tethers. And how often do you get that report from our CMOs?
Sure. So we get updates monthly, and then we provide you with the annual report, but we do get reports
Monthly.
monthly from all the care management organizations.
Okay, and then that report that was sent was from last month, 2 months ago.
The report, the data that we pulled, I believe, was for the entire fiscal year.
Oh, fiscal year.
Correct.
Okay, thank you.
You're welcome.
All right. Any other questions on this item? Next item, yeah.
Item 3, requesting commission approval of a 1-year grant agreement with the Michigan Department of Health and Human Services.
All right.
Natalie Dean Wood, Division Director for Public Health. Good afternoon, Commissioners. This
Good
is these are funds that are coming from MDHHS through CDC. And it's money that earmarked to go into 44 different health departments within Michigan to provide some support for workforce enhancement, not the normal workforce enhancement like getting bodies, but to support and enhance the workforce that we already have. So this year we were awarded the $176,184, and we plan to do some have some additional training for staff, conferences, as well as building some infrastructure at the current HAB building for security purposes. Some of our security issues are outdated, and we need to update that. And that's been a concern for the workforce in regards to the building being secure.
All right. Any questions from Commissioner? All right, thank you. Next item.
Item number 4, requesting Commissioner approval of amendment number 8 to a 2-year contract with 3 one-year options to renew with Black Family Development, Inc.
All right. All righty, any questions on this item?
Quarterly adjustments.
All right, a question?
Contract with 3 one-year options to renew with Bridgeway Services, Inc.
Commissioner Vice Chair Colleen.
Thank you, Madam Chair. So we have all 5 of the CMOs here for their quarterly adjustments.
That is correct. Fourth quarter adjustments.
The fourth quarter. 2-year with 3-year one options to renew. Are all 5 on the same schedule?
I believe they are.
And do you know where we're at with that? I see this is amendment number 8. How many 1-year renewals do we have left?
I believe there's just one. We're going through the end of September 2024. So we will start the RFP process again in early 2024.
Okay.
Correct.
So we're on the 3rd year.
That is
the
correct.
3rd 1 year. Okay, and we're gearing up to RFP these all again.
That's correct.
Thank you. Thank you, Madam Chair.
Any other questions? No. Next item.
Item number 6, requesting Commissioner approval of amendment number 8 to a 2-year contract with 3 one-year options to renew with CCMO, Center for Youth and Families.
All right, next item.
We're on item number 7, requesting Commissioner approval of amendment number 8 to a 2-year contract with 3 one-year options to renew with GrowthWorks, Inc.
All right. Next item.
Item number 8, requesting Commission approval of amendment number 8 to a 2-year contract with 3 one-year options to renew with Insight Youth and Family Connections, Inc.
Right. And next item.
For item number 9, we'll be going to the addenda. Communication from Dr. L. Syed, Director and Health Officer, Department of Health, Human and Veteran Services, Juvenile and Youth Services Division, for the notification of an emergency procurement report for the purchase order with Federated Healthcare Supply Holdings, LLC.
All right, any questions? Commissioners? So this was an emergency procurement. Is there a reason why we're looking at an out-of-state vendor other than, I guess, it would be price? Did we look at, I know this is an emergency, but how did we come up with?
So this is the last of the emergency procurements from the JDF emergency, and the Federated is a vendor that our medical team has been using since prior to the emergency.
Okay. Any questions for Commissioner Vice Chair Colleen?
Thank you.
Mhm.
I don't think it's the absolute last.
I believe.
We,
Is there one?
Approved one of these emergency things last time for retrofitting a van that was
Correct.
bought,
Yes.
and we haven't seen so I think there's one more to come.
No. So if I can clarify, we pulled the van. The vans were not received by September 30th. So we received the inserts, but we did not receive the vans. So now we have to procure them with this fiscal budget.
And that will be outside the emergency.
That is correct. That will be a regular
And
procurement
the
process.
contract we approved to retrofit will stay in place.
Yes, correct.
And
Good luck.
you're
Thank you.
retrofitting. with-
Transportation vehicles.
Right, with what?
Their specific corrections grade cell inserts for transportation passenger vans.
Okay, I see.
Same thing you need for hauling 7 of your kids around. Get in there, lock the door.
Next item, please.
We're returning to the agenda. Item F, such other matters as may be properly submitted for the committee. Well, I'm sorry, we need a motion.
There are none.
We need a
Motion.
Oh, yes, motion. Is there a motion for approval of the report?
We have a motion by Commissioner Maydew and a second by Commissioner
Okay.
Khalil.
And let's vote.
Well-trained committee is on it.
I see. Can you? Thank you. Looks like the
Sure.
motion passed. Next item.
Next item, item F, such other matters as may be properly submitted before the committee.
And there are none. Next item, please.
Item G, public comments.
Any public comments? Anyone in the audience on the phone, Zoom, emails, none?
There are no participants on Zoom with their hand
All right.
raised and no emails were received.
Then we're on to the next item
Item H, adjournment.
and meeting